the street. And then more recently, she came up with a fabulous idea, and it doesn't really involve any technology at all, but it involves a lot of common sense and good patient interaction, patient-provider interaction, family interaction, and really good communication. It is my privilege to introduce to you Sharon Schindler Rising.
Thank you, David.
Thank you so much.
Yep.
Do you need this? PowerPoint, okay.
Thank you, David. It's really a pleasure to come back to Rochester after being gone for many years and to see all the wonderful things that have happened, and especially I'm so excited about the Center for Innovation. I'd like you to imagine care that has moved out of exam rooms and into groups. Imagine what that might look like. In 1993, I was a nurse midwife caring for many, many, many prenatal women. And what I found was that as I thought about what was happening, one woman's question was another woman's question. And what I was doing was spending my time repeating myself almost all day. Have you ever had that experience yourself as a provider? The same thing over and over. And besides that, I was saying, so sorry, because I was keeping everyone waiting. I couldn't run on time. I thought, there just has to be a better way to do this. So now I'd like you to imagine, just for a moment, might be hard to do, but that you are either pregnant or perhaps providing prenatal care, or actually that you could imagine providing this kind of care for any health population. So you have been invited to join with about 10 other women to come together for your care. And you come to a room directly. There's no waiting. So you've come directly to a room that feels really good. It feels like a place that you would like to be. We've just heard a bit about architecture and space. It has a nice feeling. You come in there, you're greeted warmly, you start to get to know the other people in the group, you take your own blood pressure, you do your own weight, you chart in your chart, you read your lab data, you read your ultrasound. It starts to get demystified, all this medical stuff. And what happens is that you start taking control of your health. And after you have done this check-in, you have an individual visit in the group space, but off to the side with your provider, about a 3-minute time, where you listen to the baby's heartbeat, and you get reassured that things are fine, or you have an opportunity to discuss something that's of special importance to you. The provider doesn't answer most of your questions because, remember, your question is someone else's question. The questions come to the group. And then there is this time with a facilitated discussion where you sit and talk together about things that really matter. And the provider tries really, really hard not to answer questions, because once you have answered a question, you will never know the group wisdom. And I believe that it's our cultural beliefs and values that guide our behavior, and that it's almost impossible for us to truly understand those beliefs. So as a provider, I have this wonderful opportunity to sit and listen and understand more about these cultural beliefs and values. Well, does it work? We did a randomized trial. Our first randomized trial was through Yale and involved women who were in public clinics in New Haven and in Atlanta. For women who were in group, there was a 33% reduction in preterm birth. For the African American women who were in group, and they composed 80% of the sample, there was a 41% reduction in preterm birth. Satisfaction is off the charts. It's a wonderful way to get care. And on top of that, we noticed that there was a lot of community building and increasing sense of empowerment that was happening for the people in our groups. So a couple quick stories. One of them that has been one of my favorites is of a woman in one group who had an early loss, fetal loss. And the group was very concerned about her, but as the sessions went on, of course, she wasn't part of the group, but suddenly came back to one of the last sessions. And during this time, she had knitted baby booties for every one of the women in the group. And she remembered whether they were having a boy or a girl. And she went around to each woman and wished them safe passage for their baby. Or another story of a midwife who called me and said, I had 2 women from my group who were in the hospital at the same time. One had delivered and one was in labor. So I went in to see the postpartum woman first. And when I got there, she gave me the whole story of the woman who was in labor because they had been texting. And she knew more than I did about what was happening for her. And then there was another time when 4 of the women in group had delivered at the same time. They were all in the hospital, and you know what happened? When I went to make postpartum rounds, they were all together in the same room. And so rounds were very easy. Well, there are 13 essential elements that define the model. So the model has structure, and these elements really work for any health population. They have been, we now have centering, besides centering pregnancy, we have centering parenting, which is well woman, well baby care for the first year of life and beyond. And you can imagine how much fun that is, as you can imagine the circle of parents sitting on the floor with all the babies in the middle. What gets more interesting the older they get, of course. We also have centering diabetes and a number of other chronic care models that are developing. There are over 300 sites that are active across the United States and internationally. I had a provider call me one day and she said, this is the one thing in my week that brings me joy. And there was a patient comment actually here at Mayo. The nurse midwives are doing centering pregnancy. And one of the patients commented and said, one of the things that I really like about centering is seeing my provider so happy and enthused. It brings us joy as well. And we say it's just a better way to provide care and to receive care. Thanks.